Oh, hi everyone, and welcome to another coronavirus update. Just making sure we're 6 feet apart.
Perfect.
And for the purposes of this video only, we will be taking off our masks. But please, everyone, do not try this at home. We are trained professionals.
So we know that there's been some time since our last video. We've been, of course, open throughout the pandemic, doing clinical visits, modified annuals, and of course, a lot of virtual visits as well.
Yeah, it's true. And we've been keeping a close eye on the numbers in Montreal and Quebec. And we thought now was the right time to share some information with you.
Yeah, so here at Cardiogenix, we've been documenting the numbers ourselves. So we're using the numbers that are available every day by the government of Quebec. They do have their own COVID website, but we put our own spin on it just because the numbers could be quite confusing and sometimes misleading. So for example, when it comes to deaths, they'll report, let's say, 2 deaths in the last 24 hours, but 7 deaths in the last 3 days, and 2 more deaths from an undetermined time.
Right.
So we really try to simplify that with our numbers, just so that we get a better understanding of the progression of things.
Exactly. So we wanted to show you some data in a clearer fashion. So here in the first chart, we can see we have the total number of cases from mid-August to the present. Now, most of us think of the pandemic as starting around the middle of March and then peaking around May or mid-June, and then we had a lull over the summer, not really down to zero, but you could see here clearly taking off now in exponential fashion. It's almost like, I would say now we have surpassed the numbers of the highest peak in the first wave, so we're back at square one.
Right. And one of the major things that we really wanted to dispel, and one of the most common counter arguments we hear is that, well, we're testing more, so shouldn't we be getting more cases? And objectively, that's true, which is why we can't just look at the number of cases alone, but we have to look at how many people are actually testing positive.
Yes, and this, Dr. Liello, reminds me of the Trump corollary. So if we stop all testing, no more positive cases, pandemic disappears.
Unfortunately not. So if you look here, in early August, we saw that with all the tests that were being done, less than 1% of people were coming back positive. So that was very, very low community transmission. But more recently, we're up at about 5-6%. So this is really showing that there's a lot more community spread.
So, Dr. Liello, the positivity rate has increased 6-fold over how much time?
Really over the last month and a half. So this is exactly why we're in the red zone and why we all need to be back in quarantine.
That's frightening.
Yeah.
Now, luckily, our healthcare structure has been able to handle the increase in positive cases so far. However, if you look at the next 2 charts, we wanted to show you the alarming trend of increased hospitalizations and ICU admissions. So we could see here from September clearly an increased rise in hospitalizations. And once this overwhelms our hospitals, unfortunately, we'll be seeing more deaths. And this is why we call deaths a lagging indicator. First you have the positive cases, then you have the hospital admissions, and then you have the deaths increasing in society. And that could happen very, very quickly.
Yeah, it is very alarming. And, you know, with some of the difficulties that we see in some of our patients getting tested, another one of the main questions that we get is, when is the best time to go and get tested?
Right.
So typical situation seems to be you may come in contact with someone that you find out was positive with the coronavirus, say the day before. As soon as you find out the information, you go ahead and get tested. Now, there's some issues with that because even with the gold standard test we have available, if you go early on in your diagnosis, there's a much higher risk of getting a falsely negative result.
So true. So the PCR nasal swab is the best test we have, but it's not great, meaning that it's going to pick up, if I have coronavirus right now disease, it's going to pick it up 80% of the time, which means it has a false negative rate of 20%. So let's say I contract COVID today and I go for a test tomorrow. It's very likely that that test will come back negative, a false negative. Let's say I'm one of the up to 50% of patients that has COVID and has no symptoms. When is the test going to perform the best? Well, it's going to perform the best on about day 8. So what if you do have symptoms? Well, the test performs the best on day 4. So the challenge is you want to have the diagnosis as early as possible for many reasons. At the same time, you want the test to be as accurate a result as possible. So in actual fact, if it was possible, everyone would need 2 tests.
Oh my goodness. So if Dr. Oommen, if that's the case, does that mean we need to be self-isolating between the tests?
Exactly, Dr. Liello. Yes. Now, considering the timing of the tests and the quarantine and the delay to get the results, and do we need a second test, and the fact we're still dealing with a deadly virus, it can become so confusing. So we suggest avoid the headache and the nightmare and the quagmire. Stay inside, stay safe. We know that with or without a vaccine, all pandemics must come to an end. We just need to be patient.
This is so true, and it really brings up another very common question that we get, which is, when is this all going to be over, and what is the winter going to look like?
Right.
Now, unfortunately, we don't really know how long this is going to be. So ultimately, once we get a very successful vaccine that's available to enough people so that we have some form of continued herd immunity, then luckily the COVID-19 virus could then become just one of the routine viruses that we see every flu season. Hopefully by that point we'll have better therapeutics that'll help us manage it a lot easier as well. But whether this is going to take 1 year or 2 years or more, it's really difficult to say.
Yeah, so important. And as for the winter, there are a few factors that make it a little bit more dangerous. So first of all, we're going into the winter with already a high level of community spread. Hopefully, the latest confinement strategy will help to bring the numbers down. Secondly, the concurrent flu season and cold season may saturate our hospitals, which is why it's particularly important this year to get immunized. Keep in mind that in a regular flu season, 40,000 North Americans die. That's a regular season. And thirdly, with the cold weather, we're inside a lot more. And we know transmission is increased inside.
Right, so how do we prepare for this? So along with taking the usual precautions, wearing your mask, staying 6 feet apart, washing your hands often, I do try to tell my patients to plan ahead. Now, that doesn't mean go out and buy all the toilet paper available, but it means think really, we're going to be inside for a lot longer. Some of us can't go to the skating rinks, can't go, if we're part of organized sports, we can't go to the gym. So try to find things that you could do at home. Come up with a new hobby perhaps, or if you have a project around the house that you want to get to, if you want to start a book club with your family members, really it's going to be important to find something that you could do on a day-to-day basis to just help get through this.
That's so important because we feel the sadness and the anxiety increasing in society.
Yeah.
Now, it's important also to try to optimize ourselves and optimize any pre-existing medical conditions. There's really not a lot of medical conditions that can't be optimized with some preventive measures. So proper diet, regular exercise, good sleep hygiene. Actually, there's some good data recently that the magic number for sleep is 7 hours, which comes out of vaccine studies. And we also encourage our patients to start taking a vitamin D supplement, and that would be 1,000 international units a day.
It's really these healthy habits that are going to make such a big difference, and we really shouldn't underestimate them.
Yes.
You know, it's unfortunate, we often hear in the news, they're constantly blaming someone, right? So we're blaming young people, now we're blaming young adults, we're blaming those that are going to the bars or those that are going to the restaurants, the cinemas. Now we're blaming substitute teachers that are going to different schools, or we're blaming the different workers at the residence. But ultimately, we're not here to blame anyone, or to put the blame on anyone, rather. If you want, you could go online and look at the distribution of cases based on age group, if that's something you want to look at. But ultimately, like most of the pandemics that happened before us, this second wave was essentially inevitable. And so here we are together. And so, you know, it is unfortunate that kids don't get their gym class, that we can't go to our restaurants, that we can't go to the cinema. We're not going to be able to see our family for Thanksgiving or for any of the other major events. And it really is unfortunate, and it's sad, but it doesn't change the reality that we're living. And so we don't think that it's right to put the blame or the burden on any one group. We're really in this together, and the way we're going to get through it is if we remain united in our efforts, we respect one another, and if we're really respectful in our actions to keep as many people safe as possible.
Right on, that's true, Dr. Liello. We know that all our patients watching this are really amongst the safest people out there,
Yeah.
and you are all gonna be okay. But for everyone else, we do hope you share this video with as many people as possible to really get the message out there. And on that note, we hope everybody stays safe and best of health.